Thank you so much for your time today, Dr. Ida. Would you mind just to start off by giving us a bit of background about yourself, who you are, what you do, your training before you relocated to Dubai?
Right. First and foremost, thank you for having me here today, Emily. I am a consultant ENT surgeon. I subspecialize in otology, neurotology, and hearing implant surgery. I currently work at King's College Hospital, Dubai, and as you know, I've only just relocated to Dubai. So a bit of background about myself. I graduated from Manchester University in 2005. Oh goodness, that's 20 years ago this year.
Wow.
And I did my specialist training in the east of Scotland, so that's Aberdeen, Dundee, and Edinburgh. After I finished, or I got my CCT, which is the Certificate Completion of Training, so that's like US board certification equivalent, I went to New Zealand, to Christchurch, New Zealand, to do the Advanced International Fellowship in Otology, Neurotology, cochlear implant, and lateral skull-base surgery.
Wow.
I then moved back to Scotland to take up the consultant ENT job there in Glasgow, obviously before relocating here to Dubai.
So why did you choose to relocate to Dubai, and how are you able to use your advanced skills, training and background here now in the Dubai healthcare system?
So when we were looking to move to Dubai, although the main drive was family and personal reason, obviously I was looking for somewhere that I could continue with my career, and not just continue but to grow and develop professionally. And this is where you have been absolutely instrumental in helping me to achieve that, I would say. Because I was looking, based on my sort of like, my career background, I was looking for somewhere where I could develop complex ear surgeries and continue to offer my expertise in hearing implant surgeries. So coming here, working at King's College Hospital, Dubai, obviously it has been a steep learning curve, especially because now I am developing the complex ear surgery and hearing implants program and service from the ground up. And I have to say, the skills, the training, the experience I've had so far throughout my training, fellowship, and my experience as a consultant has helped tremendously because I have that background to build on in order to develop that service and also my career growth here.
And another point that you mentioned in our recent conversation that I loved was that you said the clinical part is actually one of the easiest parts of your relocation here, which is just a sign of confidence, which I love about you as well. And so you mentioned actually the most challenging part is just navigating the system. And could you just share some insights about that and how you overcome it?
So actually, again, it's back. I think because I've moved several times for my fellowship and then come back to the UK, from New Zealand after my fellowship and then moving here. And in each time, I found that actually the clinical aspect, because we've trained so hard for it with various sort of like exams and various things to do, during the training, that the clinical aspects of it is actually the easiest. Because that is something that you're comfortable, you know what to do. But it's the environment that you go into. Because everything's new. You're new to that system new to you, and the people around it's also new. And it's about navigating that various aspect of establishing your clinical practice, establishing the service, getting to know the system and the patient. So that is the challenges, I would say. So whenever, in fact, when I came here and it was, my practice got very busy from day one. So it was a little bit of a shock to the system because at the same time I was trying to develop the services and the program and various other things. And so when the first time I got into the operating theatre, I actually cried. I have tears in my eyes because I feel this is it. I feel like I belong.
Yes.
I'm home.
Wow.
So
I love that.
that's the bit that I feel. It's not being arrogant or cocky. It's something that I feel comfortable with.
Yes.
And something that I always know that, that's something I can fall back on.
Yes.
Because that is something I'm passionate about.
Yes.
The clinical aspect for any doctors coming here, because the doctors that you bring here to the UAE and to the Middle East are experienced clinicians.
Yes.
So the challenges, it's not so much about whether you can do the job, because you can.
Yeah.
Because you're the experts and
Yeah.
specialists in your field.
Yes.
But it's about how do you navigate that system here
Yes.
in the new environment.
Yes, exactly. Another thing I loved about what you said is that, how supportive the other surgeons are. Like, there's other highly accomplished, skilled surgeons in the region that are doing like similar surgeries or, similar skills to you, and how that they're so supportive and they're actually encouraging your success, and, they're so happy that you're actually here in the region. And yes, how did you manage to establish those relationships with your colleagues?
I would say, before coming here, and I have, I guess, anxiety about how do people perceive me coming from another country to Dubai, to the UAE.
Yeah.
One, I'm female, very small. Obviously, you probably can't tell from the video, but I am very small. And basically new to this. And like I said that, back in Scotland, I was trained there. So I have the established network within the
Yes.
UK and in Scotland in particular. Here, first and foremost, I would say I am very lucky, very, very fortunate, because my ENT colleagues, the ENT surgeons at King's College Hospital here, they are amazing.
Oh, wow.
They're not just, they are experienced and experts clearly in their field, but they're so welcoming, so friendly. And so they're not just my colleagues, they are friends, they're mentors, and my sounding board. And in fact, they're the one that introduced me, because they're so supportive, and they're the one who introduced me to the other surgeons.
Oh, wow. That's how you met.
Yeah. And I would say it applies to anything, to be honest, with anything that find your tribe. I'm sure people hear that. Find your tribe, build your network.
Yes.
And if there isn't any, you go out there.
Yes.
And connect and build that support network. And I'm so impressed and feel, touched really by the warm welcome that by other ENT surgeons, especially those that who are experts in complex ear surgery and cochlear implants. They have welcomed me, and I got to know them obviously through various gathering conferences and introduction by my own colleagues at King's College Hospital. Yes.
Wow. And how's your personal experience settling in Dubai, like living in Dubai with your family, your children? How have you found that?
So far, it has been absolutely positive experience. We've only been to Dubai before relocating here just on a holiday. The children, so I have two boys, and they have settled in amazingly well in school. And I think we had a chat about relocation.
Yeah.
And I think we talk about, the first thing that you need to think about is school.
Yes.
And I can't stress that more.
Yeah.
Because if you're coming with a family to actually organize school well before you actually come here and start work is paramount.
Yeah.
I got the kids' school arranged well before I started work here.
Yes.
And in fact, we arrived here for the kids to start school before I actually started work. So because of that, I feel that, once the family settled into their life, then the rest is quite easy.
And how was your experience working with Allocation Assist?
Right. So, Emily, I think every industry, whether or not it's finance, engineering, manufacturing, should have something that allocation assist offer, something similar, The experience has been great. It has been amazing. And if I can say one thing, that allocation assist is like a professional matchmaking service. In the healthcare industry, because I still remember our first meeting. You did not ask me, so what job is it that you're looking for? Wasn't it? You asked me about myself, about family, getting to know me, what inspires me, what motivates me, what I'm looking for with this move. And we talk about what I'm looking for in the next career growth. Yeah. And you have been instrumental, I mentioned before, in connecting me to my current job, the King's College Hospital. And just like any good matchmaking service, that you also passionate about the happiness of your clients. And in this kind, because the work in terms of the doctors working with the hospital, it's a bit like marriage. It's partnership, isn't it? It's not just about me providing the service and they providing the facility, but it is a partnership where we have common goals, so that we can then grow together.
Yes.
And like I said, that as evident as today that we have still having this relationship because you passionate and care about how that partnership goes.
Yes.
That happiness and whether or not we still like each other.
Yes.
Whether we're still growing and, and you've been instrumental in helping us to flourish in that relationship.
Thank you so much. That's amazing. Oh, you're so kind, honestly.
Oh, no, but that is true because someone did ask me and I was like, well, because you're not a recruitment service. You're not a recruitment agency. You're not really a recruitment agency. So it's not about, I need a job, you find me a job. It's about matching our expertise and what is it that I can bring into that job and what is it that I want to develop into that job. So it's not just, because this career is not just about working, doing 9 to 5, just see patients and go home. You want to develop within that. You want to grow in that.
I think, I'm just really, I just love doctors so much. Like, even from when I used to be a nurse, I've just always appreciated doctors. Like, I used to see how hard they used to work. And, I know how many years you put in to do what you do. And, I saw that with my own eyes. I really admired doctors even from back then. And then just as I've been in this industry, learning about all the nuances and, how each doctor is just so unique. There's not one doctor the same as the other doctor.
Absolutely,
you're just all such unique people. And that's why I love what I do, because I'm also very passionate about the healthcare system in Dubai, in UAE, the Middle East. I love this region so much. And so, I think that's where my passion comes from, actually, just meeting, matchmaking. Yeah. So, I really love it.
You're not just, because you need to understand the individuals that you want to match to that other individual, which in this case would be the hospital, the facility, right?
Yes.
Because say, for example, I can do that job, and the other facility can offer that job, doesn't mean that that's
it's always the right match.
The right match.
It's about the culture and the
aspiration as well.
The aspiration of the doctors.
Yeah,
exactly.
Whether or not it match with the objective, the aim, the growth of that particular facility. Yeah.
No, I really care. I really care about the doctors, and I also really care about the hospitals as well. I really care about their success in the region, and and it's just amazing, this network we've got now. These doctors, hundreds and hundreds of doctors, and it's just so inspiring. I'm just genuinely so interested in what you do, and I love learning about all the doctors' special areas of interest and then how they implement it when they get here and following their story. It's really, really inspiring. So,
thank you so much,
Emily.
Thank you for bringing me here.